Hello, my name is Dr. Cleo Rolle. Welcome to our video series called The Scientific Insights into COVID-19, what 6 months of research has revealed about this new disease. In this video, I will be discussing the current treatments for COVID-19. Let's begin by looking at the symptoms of COVID-19 disease. SARS-CoV-2 is the virus that causes COVID-19 disease. It does so by infecting through the respiratory tract and primarily targeting the lungs. The severity of the symptoms associated with COVID-19 disease are directly related to the extent of damage to the lungs and the activation of the immune system. Damage to the epithelium that lines the alveoli impacts the lung's ability to exchange oxygen for carbon dioxide. The extent of immune cell infiltration into the lungs and the production of the chemical messengers called cytokines also negatively impacts the lungs. And poor outcomes in COVID-19 disease has been associated with the overproduction of these inflammatory cytokines, also referred to as the cytokine storm. When SARS-CoV-2 enters the body through the respiratory tract, it is able to enter into cells by interacting with the ACE2 receptor that is expressed on host cells in the lungs. This interaction allows the virus to enter into the host cells where it makes more virions or virus particles that are then released to go on to infect additional host cells. And some of the targets that we are investigating for the potential treatment strategies include limiting the interaction and the ability of the virus to bind to ACE2, and so it is never able to enter into host cells. We can also impact the ability of the virus to release its genome and make more copies of the virus, as well as prevent the virus, once it's assembled, from being released into additional cells. And so we'll talk about some of these strategies and the medications that are currently being investigated and used to treat COVID-19 disease. And so something that has gained a lot of attention, primarily because it was found to be successful in previous viral infections such as Ebola, is the use of plasma from convalescent patients. And so convalescent patients are individuals who have already recovered from COVID-19 disease. And in order to obtain this convalescent patient plasma, the patient who is recovered from COVID-19 donates blood. That blood is then purified to produce plasma, and that plasma is administered to a patient who has COVID-19. The benefits of administering that plasma is that it contains antibodies, and these antibodies are able to bind to the SARS-CoV-2 virus and prevent it from infecting and entering into additional host cells. And so the hope is that you will limit the progression of the disease. Studies have shown that a single dose of convalescent plasma shortens the recovery time in patients who have moderate to severe illness, but not patients who have life-threatening disease. And so this revealed that there is a window when convalescent patient plasma would be useful for the treatment of COVID-19. So in patients who are suffering very mild or moderate symptoms, or early after a patient gets the disease. Remdesivir is an antiviral drug that is being repurposed for the treatment of COVID-19. And it has been studied in a randomized controlled trial, and I'll talk about what that is in a second. But it has been shown to reduce the median time to recovery from 15 days in patients who were not treated with Remdesivir to 11 days in patients who had received Remdesivir treatment. And so this was the first real scientific data to support that we had a treatment that was beneficial for patients who have COVID-19. More recently, the steroid dexamethasone has been shown to have some effects in patients who have COVID-19. And this was also investigated in a randomized controlled trial. And I will again explain the importance of these types of trials. So dexamethasone works essentially by blunting or turning off the cytokine storm that is normally associated with COVID-19 disease. And by limiting the cytokine storm or turning it off, there has been benefits in patients who have COVID-19, particularly for patients who are on supplemental oxygen or also mechanical ventilation. And so this also suggested that there was a time frame when dexamethasone was most useful. It was in patients who had progressed to the very late stages of the disease. And so I mentioned randomized controlled trials. And so these are the golden standard or the gold standard for investigating the efficacy of a treatment. And how these are conducted is you take a group of patients, and these patients are divided into either the experimental group or the control group. And the control group will receive a treatment that is considered a placebo, which is everything except the drug that you're investigating. And the important thing is that these patients are randomly assigned. So the researcher who is conducting the experiment does not get to pick which group the patient is going to. It is done based on usually using some type of random number generator. And the importance of that is that you can limit some of the bias associated with potentially putting the patients that you know will recover into the experimental group and the patients you know will not recover into the control group, to make it seem like your experimental group is actually doing better than your control group. But you get rid of this bias when you do a randomized study. And you can even make these studies more effective or more scientifically rigorous when you conduct a double-blind study, so that usually not only the patients but neither the researcher knows exactly which group the patient is in. And so that would be an added layer of eliminating some of the bias that might be associated. And so when you do these types of randomized control trials, you prevent any type of selection bias, and you ensure that whatever outcome you get is directly related to the treatment that you're investigating. And so if you recall, I mentioned that so far Remdesivir, dexamethasone have been investigated in randomized controlled trials. Similar type trials are underway for convalescent patient plasma. So just to recap where the current potential treatment strategies for COVID-19 are actually targeting. So the convalescent patient plasma or antibodies are targeting and preventing the virus from actually even entering the host cells by inhibiting or blocking the interaction between the virus and ACE2, which is critical for entry. And then we have hydrochloroquine, which may play a role in the acidification of the endosome and the release of the viral genome into the host cell to support or allow more copies of the virus to be made. And then you have the antiviral remdesivir, which prevents the virus's ability to make more copies of its genome, as well as more copies of the message that is needed to make more proteins, which are then used to put together more viruses. And so each of these potential treatment strategies are acting at different stages of the infection. And so just to summarize, what we've learned so far from the studies that have been conducted is that the efficacy of the treatments depends on the severity of the disease as well as when they are administered in the time course of disease. So some of the treatments are more effective when administered early on after the onset of symptoms, whereas some are effective regardless of when they are administered. Also, we know from some of the research that's being done on the cellular level that the different treatment strategies are likely targeting different stages of the virus life cycle within the host cells. And to recap the current treatments that are being discussed for the treatment of COVID-19, convalescent patient plasma and the antibodies that it contains block the virus's ability to enter into host cells, and this has been shown to be most effective in moderate to severely ill patients. Remdesivir is an antiviral that we know inhibits viral replication and has been shown to be effective throughout the course of the disease, and it is shown to shorten the extent of the disease by a few days. Dexamethasone is a steroid that we know suppresses the immune response, particularly the production of the cytokines and the cytokine storm, which we know is associated with severely ill and life-threatening symptoms. And so this has been shown to be most effective when administered within the first 7 days of symptoms, and so you never get to those more extensive stages. And then hydrochloroquine has shown really no benefits in a randomized trial because those types of studies haven't been done. And so all of the research or the studies or the positive results that you are hearing about is anecdotal, about 1 or 2 patients, but we don't know how that will work in for most patients because it hasn't been evaluated rigorously.